The brachialis is a flat fusiform muscle and it lies in the posterior part of our anterior compartment of the upper arm. So the other muscles that are in the anterior compartment of our arm are the coracobrachialis, which is superior medial to it, and then the larger biceps brachii that everyone would recognize. So most people are familiar with the biceps brachii. It's got that characteristic shape and it's the large superficial muscle. But interestingly, it's not the strongest flexor of the elbow. It's actually the deeper brachialis muscle that is the strongest flexor of the elbow, and that relates to where it originates and inserts to. So it originates on the anterior surface of the distal humerus. You can see it here just lying really close to where the insertion point of the deltoid is, on the deltoid tuberosity. So it sort of starts on the anterolateral distal humerus, and it then inserts further down just across the elbow into the tuberosity of the ulna, and also into the anterior inferior surface of the coronoid process. So the coronoid process of the ulna, if we just put the brachialis back on and zoom out for a second so you can see that full muscle. So distally, it's said that the brachialis muscle has two distinct heads, or at least some studies suggest this. It's got this larger superficial head that inserts into over the ulnar tuberosity, but actually in some people there is a second deep head that comes off as an aponeurosis that comes off of this tendon, like a ligamentous band essentially, and the tendon also sort of has an extra insertion on that coronoid process, but most textbooks will just write ulnar tuberosity as its insertion. So let's move on to the innervation. It's innervated by this, which is the musculocutaneous nerve, and that's the same as all the muscles in the anterior compartment of the arm. And the musculocutaneous nerve lies underneath the biceps brachii, so it sort of sits between the biceps brachii and the brachialis muscle underneath. And if we just remove the biceps muscle now, you can see that a little bit more clearly. It originates on the, or rather from the lateral cord of the brachial plexus, and that's derived from spinal nerve roots of the anterior cervical rami, C5, C6, and C7. But additionally, just as just a side note, there's some people that get dual innervation, so the musculocutaneous nerve will supply the brachialis, as will their radial nerve. And you can see that on the posterior view, that how the radial nerve comes down the back of your arm and runs on the lateral surface of the brachialis muscle. So not everybody, but some people will have innervation from that too. So in summary there, you just really want to learn that the musculocutaneous nerve supplies the brachialis, but some people do have the radial nerve if you're interested in that. So let's move on to the blood supply. It's supplied by the brachial artery. But it's also got blood supply from, in a lot of people, by the radial recurrent artery. So the radial recurrent artery arises from the radial artery. You can see that here. And so as the radial artery comes off of the brachial artery. As the radial artery comes down the forearm, you'll see it gives off that branch, the radial recurrent artery. It's called recurrent because it anything in the body that's called recurrent goes back sort of upwards. So you can see how it rotates back up towards the brachialis muscle. And it actually anastomoses the radial recurrent artery with the profunda brachii, so that's the deep brachial artery in essence. And the profunda brachii, of course, comes off of the brachial artery. So there's just the front anterior view of those two arteries. So function of the brachialis. We mentioned before that the brachialis muscle is the primary muscle that's involved in elbow flexion, and it does so in all positions and at different degrees of forearm supination and pronation. It's a pure flexor, and that means that, you know, unlike the biceps brachii that goes across your shoulder and goes to the radius bone, so it's got multiple different actions, the biceps brachii, this muscle just goes from the humerus to the ulna, so it only acts at the humero-ulnar joint, and hence it can only produce flexion, singular movement, and that's the reason why it's the strongest flexor of the elbow. Note that it does not have any attachment to the radius whatsoever. And so that completes the tutorial on the brachialis anatomy. I hope you found this useful, and if you have, make sure you click the like button, subscribe, and we'll see you on the next one.